Order. Today is Monday, April 24th, and this is the Health and Human Services Committee. We have 4 items on the agenda today, and this, of course, is a continuation of our FY24 operating budget and CIP amendments conversation. And our first item on the agenda is our Behavioral Health and Crisis Services team. I will turn it over to Ms. Yao to tee this one up, and then turn it over to Dr. Bridgers and Dr. Santiago to make some opening comments. Ms. Yao.
Good afternoon. For fiscal year 24, the executive is recommending $53,176,954 and 250 FTEs. It's an increase of $2.3 million or 4.6% over the fiscal year 23 level. There's also a proposed increase of 14.5 FTEs. The table on the page 2 of your packet shows the 10 program areas in behavioral health and crisis services, along with the recommended budgets and FTEs for each of those programs. I didn't know if you wanted to have, okay.
Yes, Dr. Bridgers and Dr. Santiago, if you can make some opening comments.
Good afternoon, HHS Chair, Councilmember Albornoz, Councilmember Lutke, Councilmember Sells. It's again a pleasure for us, our HHS senior leadership team, to sit with you this afternoon. Our conversations have been very candid and very deliberate and frank. We need staff, we need nurses, we need psychiatrists, we need therapists, and we've been working very hard. I've even asked our Chief Medical Officer, Dr. Davis, to join me this afternoon to add her insight and her reach to help bring the clinicians into the Department of Health and Human Services space. But it's an arduous task. We'll get there together, and Dr. Santiago is working very hard to ensure up our behavioral health and crisis services service area. So I will stop there, and I will pass it over to him for some opening remarks. Thank you.
Thank you for the opportunity.
Gotta hit the button.
I guess I'm still not used to this. Thank you for the opportunity to be before you, Councilmember Albornoz, Councilmember Lutke, Councilmember Sales. We're grateful to be here and for this opportunity. I also wanted to thank Vivian for a great job with the packet, and also Taven Morris, who's our OMB staff person. And so we're looking forward to this budget for next year with the increase. We have lots of dreams. I think you've heard plenty from me at multiple times in terms of our vision in behavioral health, crisis response, restoration center, and more. And we're just grateful for the opportunity to move forward. So hopefully today we can clarify any questions that you may have, and we're ready to go.
Great, thank you both. I know the work has been difficult, and Dr. Santiago, I know you had a rough night the other night, so very
still alive.
Very difficult community meeting on an important subject matter related to what we're going to be talking about this afternoon, because we have the testing of a system like we've never seen before, and clearly the need for an all-hands-on-deck approach. And understandably, there are community concerns, but there's no question we need this restoration center as soon as humanly possible to address some of the many needs that we're seeing in the community. One of the things that I found most alarming recently is that, Maryland has the longest wait times for emergency rooms in the state, and Montgomery County's proportion of that is even higher, and our residents demand better. And it's not anyone's fault necessarily. It's a systemic challenge, and it has to be dealt with as such. But we have to make incremental changes. We also do know, and we'll get into this further into the packet, there are a number of vacancies on this team, which is consistent with some of the challenges we're seeing nationwide. So would love to, as we go deeper into the packet, not unlike what we did this morning in talking about the strategies that the department is utilizing to both recruit and retain staff, seeing what you're doing in this space as well is critically important. And also acknowledging the incredible work of our nonprofit organizations and their engagement in this work as well. So with that, I'll turn it over to you, Ms. Yao, unless colleagues want to make any opening comments. Nope. We will jump right in.
Okay. Before we go into the first discussion item, Council staff did want to highlight that the council received a significant amount of public testimony advocating for increased funding for the crisis center and 24/7 staffing of all mobile crisis teams. The first item for discussion in the packet is what the HHS chair just references, vacancies in behavioral health and crisis services. As of March 2023, the service area had 28 vacancies, and of those 28 vacancies, 4 positions have been vacant over 1 year, including a nurse practitioner, 2 therapists, and a program manager. Of the 17 of the other 28 positions are therapist positions. 1 is a medical doctor psychiatrist position. The committee may want to explore why these positions are vacant and whether the vacancies speak to issues related to recruitment. For example, are there, for therapists and nurse practitioner vacancies, are there challenges? Are there, as there's a great demand for these services, are there strategies for attracting these potential employees? And council staff does note that the council received testimony from the executive director of NAMI that said that there's a need for the budget to reflect competitive compensation so that the county can recruit these mental health professionals.
Yes, I think we would love to hear from you all about what's going on and strategies. Dr. Santiago or Jason or anybody?
Yeah, in general, we're leaving no stones unturned. I mean, we're working with OHR on classification systems, and we are getting some good responses there. We're also working on recruitment, job fairs, also partnering with universities for interns. We're trying to create some pipelines, like from broker positions to merit positions. Some of my staff even tap at a personal level. They know people, and sometimes that's even a little more successful than just the traditional pipeline approach. So I will mention that I do have staff that are on fire. And what I mean by that is that they jump when there's an opening, and they're sending their position management forms, and they're ready to interview people. For some positions, we see that we have declines, and for other positions, we're a little bit more successful in other parts. I think that the challenge is a lot, from my perception, at the crisis center, and we're exploring all kinds of approaches to incentivize, to try to make those positions viewed as the place to serve. You're in the front lines in behavioral health when you're at the crisis center. And we do believe that some people come to us and want and remain there. They're very loyal just because they know that they're in the front lines, and they're very respected. I mean, we've been doing this for 20, 30 years. So we feel very good. We probably could do even more messaging with respect to what it means to serve in the front lines, that it's a place to be. But just to summarize, I think we're not leaving any stones unturned in terms of recruitment efforts.
And Councilmember Albornoz and HHS committee, as Dr. Santiago indicated, we are not leaving any stone unturned. We're looking at virtual job fairs. We've actually gone to the area universities and looked within Montgomery County. And to all of the great countyans who are watching this telecast today, we invite you to go to our Montgomery County Government Career site. Through this medium, we've been able to identify 11 therapists. So we are actively recruiting for clinicians and therapists and nurses to support our behavioral health and crisis services. So it just doesn't stop. Dr. Santiago mentioned the snowball effect. So we are getting it out by word of mouth. And so again, I referenced Dr. Davis, who's been helping guide some of the clinical support, either through her interaction with our health officers and other jurisdictions, but also through professional networks as well. So we are accessing all avenues of the recruiting pipeline.
I would just clarify on the 28 positions that are vacant or that were vacant at the time. 5 have been filled and 7 have a candidate selected, which means they had a candidate selected as of the beginning of this month. So they might be filled already or somebody started today. So there is progress being made. There's a lot of work. As you said, that some of the ones that show the furthest away, normally that's because we've had multiple people decline, because we do try to fill the longest open position first, obviously. But if we offer to multiple people and the oldest person declines, it sort of bumps down the list. But one of those long-time position does have a candidate selected, long-time vacancy. So there is progress being made definitely on the hiring, but it's a lot of hard work that they're going through to do it.
And if I could add, I didn't mention this in terms of strategy, but we are exploring and we have started to use other models of both recruitment and also personnel for mobile crisis teams. So back in 2022, in the spring and summer, we started to hire peer support specialists. We've trained them well, and just this January, they have started to be one of the 2 members on the mobile crisis outreach team. So that alleviates a little bit the need for the clinicians with the licensed clinicians, so it provides additional support. So we're using that. We're thinking of also adding more case managers at the crisis center to also alleviate the burden on the clinical licensed therapists. So those are other strategies that we have been doing already, and has helped us keep the 24/7 option of the crisis center over the last few months. So those, even rethinking personnel activities is another strategy that we're using that I wanted to make sure that we mentioned here.
Thank you. I appreciate that. Councilmember Lukey.
I just first off want to say thank you for all the creative ways that you're trying to manage making sure we have things covered. And I do think that the word of mouth method is what really matters, particularly in this type of work where people say that's a team I really want to come be a part of. And I know that it's critical as well for us to have that agility within what we offer or how we are delivering the services, because we need to be able to be adaptable to different needs, and we need to make sure that whether they're clinicians or peer support providers or case managers, that they know that the number of tools in the toolkit that you're letting them do their work with is as robust as it can be, so that they can continue to shift as work evolves and as the landscape changes. You know, there's no dispute that the need is great, vast, and that we need to make sure we have adequate personnel to fill those roles. But I do think there's a lot of creativity in how we are able to do it. And I know you and I spoke about this, Dr. Santiago, but the conditional licensing model as well for our clinicians, our licensed clinical social workers. Can you talk about how that's working?
Yeah.
And what that will mean for the pipeline moving forward?
Thank you for asking that question. The model that you're referring to has been pioneered by my colleagues in children, youth, and families, and we're applying it now in behavioral health, which is basically to reach out to those who are graduating with master's degrees in local universities and asking them to go ahead and apply for the position contingent on them finishing their degree and getting their degree plus their license. And but that is a very helpful, attractive for a young graduate. And one thing that on our side, we know that they may not have the experience of a therapist with 3 years of experience, which is another strategy we're working with OHR to see if we can reduce the requirements in the classification for experience, because those requirements were done at a time, maybe 20 years ago, when there was plentiful people that were applying for positions. Now we find ourselves at the opposite. So we have to open the doors in our classification. So we have a wonderful working relationship with HR that is allowing us to make some adjustments. But thanks for asking that question. Very, very important one.
And I just wanted to make sure I clarified, because not everybody may know, obviously the county doesn't control the credentialing required for these roles, but there was a change that was made in order to allow for this conditional practitioner category, if you will, that's allowed statewide. And so I'm really happy to hear that we're availing ourselves of that within the behavioral health space as well. Thank you.
All right, let's keep going.
Okay, there was one item that council staff briefed in the packet, and at the April 17th HHS committee meeting, Councilmember Lutke raised a question about a particular vacancy for the crisis intervention team clinician, and why a similar position for the city of Rockville had been filled sooner. Council staff understands that MCPD intended to reclassify the position to a supervisory level therapist, and that, I think, contributed to the delays, but the department is here to answer any questions about that process.
Yeah, I'll be happy to answer. So the request from Rockville City came 2 or 3 years ago. I think the request might have been already with us before I started in October of 2020. So that there was a long history. At that time, we thought that we would not have any trouble with therapists hiring. Now, in the last year, we know that that's not true. Given that long history, we did not seek to prioritize Rockville over MCPD. In fact, we have prioritized MCPD for many, many years by having Beth Tabachnik. Now she took the position of crisis center manager, and we're still working very, very aggressively with MCPD on their dreams as well. And we welcome those dreams, and we hope that we can meet them. And as we develop these strategies for hiring clinicians, and yes, I'll stop there. Yeah.
Great. I'll just note, too, there was a lot of really powerful testimony during our public hearing, but there was a behavioral health specialist on the crisis response team that, talked about the challenges that her and her colleagues are facing, and also talked about the important partnership with MCPD, that it's not an either or. There needs to be a synergy, and this was directly from somebody who is on the front lines, who is on the receiving end of these very challenging phone calls. There has to be a synergy between both agencies. So, and I know we're continuing to make progress. Ms. Yao? Okay,
so getting into the expenditure review for fiscal year 24, council staff notes that the only increases in the executive's budget for the service area are in multi-program adjustments and in grant funding. However, there is one item that was proposed for reduction that council staff is recommending be put on the reconciliation list, and that is a reduction to the supplemental for residential rehabilitation providers of $110,549. The executive is recommending basically a 10% reduction to the contracts provided that are to the providers that are receiving this supplemental: Cornerstone, Montgomery Family Services, and the Rock Creek Foundation. And the council received testimony from both the Rock Creek Foundation and Cornerstone, requesting that this reduction not be taken. Executive suggests that the proposal to reduce is because the fee-for-service system adequately compensates providers for these services. But the county has been providing this administrative support for over a decade, and the executive actually a number of times has recommended reductions that the council has not taken. So council staff recommends not accepting this item and placing this money as a high priority on the reconciliation list. The funding assists organizations with overall costs and supplements services that are not sufficiently covered by fee-for-service, and especially at this time with substance disorder services, are really, severe at this time. Council staff thinks that it would be good not to take this reduction.
So I agree. Heard also compelling testimony from Cornerstone. The 10% may not seem like a lot, but when you consider the inflationary expense adjustments that have all gone through the roof, the challenging and recruitment of retaining staff on the front lines in this work, you can understand why 10% is challenging to me. But I certainly understand and respect the department's attempt to try and provide a balanced budget. I will say, though, and this is not entirely ready for prime time, I'm just going to, again, say this at a high level, but there will be a memo forthcoming to colleagues. Last year, there was an inflationary adjustment proposed by the county executive of 4%. The council added to that to making it a total of 8%. And this year, the county executive has proposed 3% on top of the 8% that was added, which has certainly been well received by nonprofits, but understandably still falls short of keeping pace with the inflationary expenses that they're seeing and feeling across the board among all sectors. And so I will propose an across-the-board increase once again for consideration, because there are going to be many, and there already have been, circumstances in which individual organizations are understandably asking for additional resources and support. We're not going to be able to do that for everyone. And so it will give us another option to consider as we go through the final couple of weeks of the reconciliation process. And this is a good illustration of that. So with that, without objection, colleagues, the 110, or any questions?
No,
Councilmember Sales?
yeah.
Thank you, Mr. Chair. So I am in agreement with restoring the 10% cut that was recommended. I just wanted to find out, since the county executive has recommended these cuts in previous budgets, has all of the funds been used, or have we had to roll over any funds in previous years?
I am pretty sure that they all are used. As this is a supplement, so it's not necessarily a fee for a service. It's supplement, I think it's just paid to them monthly, essentially, as an amount. So I would be very surprised if any funds were ever unused. And I can't speak for certainty, but.
Thank you. This was just to restore the 110, not the additional.
I believe so, yes.
Correct,
Yeah.
just the 110.
Oh, okay. It's mentioned.
To
Oh,
put it,
I'm going to propose that later.
Yeah.
For our third HHS session.
yeah, this is just to add it to the reconciliation list,
Yep.
just to add the county executive's proposed cut. We want to add it not as a cut, but to put it in as an addition on the reconciliation list. But I did want to ask a question clarifying that, because it does say on here, that there's support for transitional aged youth, but I wanted to clarify that there isn't a program in the county for residential substance use disorder treatment for adolescents. Is that right? Or there is?
There is, yeah, and that's correct. That's correct, not residential, right.
Right. Thank you.
So then, without objection, we'll support restoring the 110 as a high priority on the reconciliation list.
Great. The next item is a reduction of $409,910 to align adult substance use disorder services to match actual expenditures. The cost for these services transitioned to fee-for-service several years ago. DHHS held back some in the cost center to pay for clients who would not be able to, who vendors couldn't get the collect from them. And it turns out to be, I think, more than what was needed. So after the proposed reduction, $437,357 will be left. And the department anticipates that this will meet anticipated needs. Okay. The next one is elimination of $678,471 for the state opioid response or SOR2 grant. These fund mandated delivery of medicated assisted treatment services to those incarcerated at the correctional facility. The reduction is to the SOR2 grant, and funding does remain in the SOR3 to support the services. So council staff recommends acceptance.
Without objection?
Okay. And the last item is a SAMHSA coverage to care grant, $1,832,794. This is to expand the care continuum community's goal of providing crisis care that diverts people from emergency departments and jail by expanding crisis services to match their needs and to connect them with follow-up and preventive crisis services.
Without objection?
And that's it for behavioral health and crisis services.
Great. Thank you, Dr. Santiago. Next, we move on to Children, Youth, and Family Services. And Ms. Treadvance will join us. All right, and as Ms. Treadvance is getting settled in, I just want to say publicly once again, she had very big shoes to fill in her role, and she is filling them well and doing a lot. So we really do appreciate your leadership. So with that, I will turn it back over to you, Ms. Yao, for some opening comments, and then to Ms. Treadvance to make some opening comments.
Okay, great. For fiscal year 24, the executive is recommending $119,751,275 for the service area and 618.57 FTEs. It's a difference of an increase of 4.2 million or approximately 3.7% change. The service area has 8 programs that are listed in the table on page 2 of your packet with the recommended budgets and FTEs for those service areas. I would say most of these programs actually were discussed at the Joint Committee this morning, but there is a couple items for the committee to discuss this afternoon.
Great. Ms. Treadvance, any opening comments?
Afternoon. It's afternoon. Good afternoon. A long day. It is a long day. I just thank you for your support for the body of work that this unit does. Really, truly wanted to say thank you. It was some big shoes to fill, and I would not have been able to do this work without the amazing leadership in the department and also with the team that we have in CYF. And it is truly an honor. People from Montgomery. Nobody loves Montgomery County more than people from Montgomery County. I'll tell you that. And they show up to work every single day at CYF, and I just wanted to say, like, this paper doesn't, it's just numbers on a piece of paper, but it translates into real stories for people, real services and real transformation for people, and we wouldn't be able to do this with people. So just really wanted to say thank you for honoring those values and for appreciating the work that we do. That's all.
Thank you. Ms. Yao.
Okay, so the first item is one that we've discussed in a number of different contexts, but it's the vacancies in Children, Youth, and Family Services, particularly child welfare services and the Office of Eligibility and Support Services. As of March of 2023, the service area had 109 vacancies. Of the 109 vacancies, 30 FTEs have been vacant over 1 year or more, and that totals an annual cost of $1.3 million. Of the total vacancies, 48 are in child welfare services, 44 are in the office OESS, And these two programs have historically experienced high numbers of vacancy and turnover. So there are 40 social worker vacancies, 34 government assistance eligibility specialists, 9 community service aides, and 5 managers. The post-pandemic vacancy numbers are significantly higher than the pre-pandemic years, where the programs already carried high numbers of vacancies, which often impacted the workload of existing staff. So, for example, in fiscal year 19, Child Welfare Services carried 21 social worker vacancies, and OESS carried 19 eligibility specialist position vacancies. As again, this is not surprising. We've been talking about this in context of therapists and school nurses, et cetera. But council staff does note that there is a confluence of these recruitment and retention issues in addition to a significant number of retirements as well, even at the management level, and this creates challenges for the service area as well as the department as a whole. So the committee may want to request, a little bit of information how the two programs are managing the work and what strategies they've been able to implement to recruit and retain these critical employees. While council staff doesn't recommend, eliminating any of these positions, it would be helpful to understand perhaps the typical ebb and flow of hiring of these positions, and generally at any given time, what is the highest number of these positions that the department carries.
Thank you. And to add to that, the work has increased, right? So the caseloads are through the roof, which impacts our incredible professionals' ability to be able to do their jobs and do it well. And of course, when you think about the populations they're serving, that is alarming, to say the least. But I know we are working hard from a number of different angles. I don't know if Dr. Bridgers or Ms. Treadvance, you want to speak to similar to what we did with behavioral health strategies that we're utilizing in this space too.
So thank you, HHS Chair, Councilmember Albernos, but I've been dying to say this all day, so I'm going to yield to Ms. Treadvance, who can speak. The mission is the same, and we continue to work across HHS. We have moved significantly away from a siloed approach. We know that we can't do it individually in trying to recruit the staff, the level of expertise that we need, and all of the chiefs are really energetically involved in our recruiting practices. So I just want to say that, and I want to thank all the chiefs who are either in this hearing room this afternoon or who will be in future budget sessions. We are working to get there together, and we solicit any comments, ideas, and support from the council as a whole or independently as a committee.
So nothing more to add. It's pretty much the same reasons that you heard Dr. Santiago reference in terms of why we're seeing a lot of the vacancies, a lot of social workers. It's a national issue. We are employing different recruitment strategies. Some of them include seeing how we can innovate at the state level, also how we could partner better with universities. We're looking internally how we could use maybe consultants a little bit better, and then also doing internal assessments of the landscape to see where shifts are happening and where we might be able to make some tweaks in terms of compensation or being able to recruit people, just make us a little bit sexier for people to want to come and work with us. So we're employing some of the exact same strategies, and as you could see from what Dr. Santiago referenced earlier, we're learning from each other. So if we see something works in one service area, we're adopting it in others. And the causes and the reasons are the same: national issue, a lot of retirement, and it's a catch-22 because the caseloads, because of the shortage, the caseloads increase, but then also one of the main reasons why people leave is because the caseloads are so high. So it's a very complex issue, and we are just trying to play with the Legos until we figure out something that sticks.
Thank you.
Just to give some context on the positions, one note is while the total vacancies provided were tax supported, most of the vacancies in child welfare and OESS are actually mainly grant funded. They're funded through our House Bill grant, which the way that works is 90%, 70 to 90% of the cost is paid for by the state. The county pays a portion of it. So they're on the list because they are partially tax supported, but they're mainly grant funded positions. I will state with the OESS positions, when you talked about the ebb and flow, we're likely at the highest level because we just did a massive interviewing and hiring. I think we had 30 candidates interviewed, there's a large amount of candidates going through that hopefully will then lead to positions coming on soon. So it's been a little while since they've done one of these massive, ads and then a whole bunch of candidates at once, and so that is happening. So hopefully that'll lead to this being the high point of the OASS vacancies. There's also recently a round of interviews with the social workers and child welfare services also that I think a couple of them are coming out. So it does ebb and flow. Some of it's when we generally do a lot of group hiring for those large positions, so it's sort of when the most recent one of those has been done can lead to when, the ebbs and flows of the positions.
Great. Councilmember Sales.
Thank you, Mr. Chair. So I did have a question about some of these creative funding mechanisms you're putting in place. The county executive proposed a $10,000 signing bonus, or was it $20,000 for police officers? Are you recommending any hiring bonuses for these very important positions?
I do not believe that's in it. Those are things that would be collectively bargained and sort of is more of the responsibility of OHR. We obviously are working with OHR to discuss any options we can, but those are not decisions that the HHS would make on its own or even put forward. Generally, like I said, those are collectively bargained for the union positions.
Okay. The next item is the Treehouse Child Advocacy Center of Montgomery County. The Treehouse is an independent nonprofit that partners with the county to provide a single location for services for children who are suspected of physical or sexual abuse. For fiscal year 24, the executive is recommending $751,747 for the Treehouse. It's a 3% increase or inflationary increase over the fiscal year 23 level. In addition, council staff understands that there is a forensic interviewer position that will be part of the Treehouse's 24 complement that will be supported through state funding. According to the Treehouse's budget, the county funding will be approximately 44.8% of total revenues for the organization, and the other major sources are state funding for transitional trauma and crime prevention and private sources. The table on page 4 of your packet shows some of the increases in what the Treehouse is seeing in terms of especially mental health, forensic interviews, family advocate, those kinds of services are pretty significant compared to the pre-pandemic numbers. And there's additional information on service data, client age and gender that's included at circles 9 to 10 of your packet. And council staff does recommend approval of the recommended amounts for the Treehouse.
I think without objection. Yeah, and I want to publicly thank the administration. We recently had a very positive meeting with Treehouse in our office, and they updated us on the capital renovations that were made in partnership with the Department of General Services, and it puts them in a significantly better position to be able to address the needs of their clients, which are literally the most vulnerable of the most vulnerable. And so that was a great effort and great partnership, and I just want to thank the administration for their focus on that. So I think that's it for...
That's it. All the rest of the adjustments are multi-program adjustments for the programs or reviewed by the Joint Committee this morning.
Great. Thank you very much. We move on to item number 3, which is services to end and prevent homelessness. And we welcome Ms. Alana Branda, who is acting chief while we still work through the OHR process, but want to thank you very much for your continued leadership. And would you like to make some opening comments?
Sure. Thank you very much. As you noted, it's an acting, so while I have been privileged to serve as the deputy for the last 4.5 years, so I hope I will be able to help walk you through any of the questions that you might have on our budget. I know this is part one, I think, of three for Steph's budget, so I know we'll talk a lot more on Wednesday and some on Thursday. I do just want to just quickly note that our work is really intense, and we've talked about that a couple months ago, kind of gave the lay of the land of where things are. But we're continuing to innovate and work in different avenues. And to that, if you haven't seen the news, we just got awarded a $4.8 million grant from HUD. We are the only jurisdiction in the state of Maryland to receive this grant. It's through they did a special NOFO process. They had some additional funds, and so they collected all those funds together and did a specific funding opportunity to work with unsheltered homelessness. So we're really excited to receive this honor and to be able to continue to bring more services and programs to our residents who are most at risk in many ways and living unsheltered, living on the streets and in places not meant for human habitation, and really bring some additional resources to working in that area. And then just, I know we'll probably come back and see you soon after budget. Our PIT numbers, our point in time, the annual count that we do in January, those numbers will get released late next week. So we'll happy to come after budget and talk through more of what we saw from that and where we'll go with those numbers.
Thank you. And Ms. Brando I was in her car while we did the point in time count a couple of years ago. And I saw firsthand just the incredible work that this team does every day. So with that, I will turn it over to Ms. McGuire and Ms. Clements-Johnson to walk us through the packet.
Thank you. So as Ilana noted, this work session is focusing on shelter services. The HHS and PHP committees will meet jointly to review the rental assistance, eviction prevention, and programs related to the Housing Initiative Fund on April 26th. And then during that time, also we'll present the rest of the SEF portfolio, including the information on vacancies, et cetera. So our first is the overview. The executive is recommending an additional $4.4 million for the FY24 operating costs of the homeless shelter system. All of the recommendations consist of one-time funding items, except for the $388,000 in security services for the interfaith work shelters, which is planned to continue and become part of the base budget. So shelter services, shelter providers in the community include Interfaith Works, Montgomery County Coalition for Homelessness, and the City of Gaithersburg. Each of the entities maintain contracts with DHHS providing shelter services for men, women, and adult households. Contracts are a mix of open solicitations, RFP, and non-competitive grants, which also influence their pricing structure. And then we just wanted to note that in the FY25, the majority of the shelter contracts are planned to transition from non-competitive to a request for proposal procurement process. So we will start with our first area, which is overflow sheltering. You'll see in the chart, council staff has split this into two, recommending half of the funds be high priority and the rest of the remaining funds be identified as priority. This request is due to DHHS seeing a substantial increase in requests for shelter from households being evicted from their home with no diversion options, need for support for families after disasters, overflow from the Newcomers Initiative that is only able to support 16 households, and condemnations from DHCA where the displaced family doesn't have an immediate place to go. So the overflow sheltering really helps support just those urgent needs for people needing to be housed. So DHS provided details on the policies and process for being placed in overflow. I won't read through those, but council staff's recommendation is to support additional funding for this effort. We did recommend that the amount be split with part identified as high priority and the other as priority. This approach will allow the council flexibility to meet affordability constraints if needed, and will allow the council and the department to monitor the needs and experience in the beginning of the year and to adjust efforts as needed. That's it.
Without objection? No?
Yeah, I have a question.
Okay, two questions. Councilmember Sales followed by Councilmember Lukey.
Just a quick question about the transition for, it looks like in FY25, the contracts are switching to RFPs from non-competes?
Yes.
Okay, I agree with the transition, but I was just wondering what triggered the shift.
They were actually scheduled to shift right before COVID, and that was delayed given the refocus of many of our attentions. But there's a couple that are RFP, and to put equity and parity across all of them, the intention was to shift them all to RFPs. So just the timing with procurement, FY25 is when we'll be able to execute that.
Good. And then I had another question about the, I don't know if we've gotten here yet, the disaster management staff. I know that some of these displacements are related to disaster management, and just wanted to know if there are issues with their funding or staffing, why they're not able to support these displacements.
So I can speak a little bit to that. So initially, HHS does have a team led by Patrick Campbell, who does the initial on-site assessment, reunification if needed, that first 48 hours, let's make sure people are safe and secure. At that point, it is work to shift the support for those families to SEF. And so that may be relocation, if it's known to be a permanent displacement, so helping them with housing location. We cover security deposit and first month's rent, or if it's a temporary, working to provide that temporary housing. Depending on the scenario, HHS may open an emergency shelter, usually that's for at most 2 weeks. So if the displacement is intended to be longer than that, they do shift to SEF's emergency sheltering and housing. It is SEF's standard staff who is doing all of our housing stabilization work who supports these households. And so at points there is an ebb and flow in terms of, we have been very unfortunate in our community that we've had a number of very large disasters and fires and, these displacements. I actually, from the nonprofit side, I ran the victim compensation fund from Flower Branch. That was one disaster, and we didn't have anything for 3-4 years about after that. And, so we, to your point, right, we have been assuming it within people's existing job duties. There is not a separate housing team that works specifically with the households. As we are seeing increasing in evictions and we're seeing increases in disasters, it has put some strain on the team. But we do have, as part of the emergency rental assistance from the federal government, we do have additional staff that as we are winding up COVID rent relief, which I know we'll talk about more on Wednesday, they are available to support all of the eviction prevention and displacement work also. So we will have 19 more people on our team to work on these efforts.
And since we're going to continue this discussion later this week, do you have numbers on the evictions and the displacements related to disasters? If you can provide more specifics on both of those things.
Yeah, I can plan to bring on Wednesday.
Thank you. Councilmember Lutke.
Yep. So my questions are about the federal funding that comes when there's a disaster, because obviously some types of disasters come with some federal funding and some don't. And we've had some of all kinds happening here in the county lately. So it's not clear what revenue gets replaced with federal funds that we're able to secure for relief in providing this assistance, knowing obviously that we have to provide it up front and then you're getting reimbursed on the back end. But it's hard to look at this and tell what the net cost is to the county versus, outlay here, income back in from the feds on another side. And I note that both the overflow sheltering item and the COVID sheltering item, and I will talk about that separately, or about the fact that the pandemic is as a national issue being put to rest, so to speak, that we are not necessarily doing the best job we can in managing our resources, in trying to take on things that have been federally funded or take on things that are one-time funded. This says one-time only, but they're not one-time, because this is an ongoing expenditure that we've been doing for several years now, right? So why is it being classified as one-time only? Is there an anticipated end to those programs, and that's why you're classifying it this way?
Yeah. So our budget has historically had funds for overflow sheltering in it. What we're asking for is additional from that. And so we are putting that in as one-time only because we are trying to get a better assessment and balance of what is the new normal in a way, right? Like there has been such a difference to how our system is being used in COVID. We are seeing evictions go up. We are seeing the federal money for that rent payments, it's drying up, right? And so we want to make sure that we can maintain emergency housing for people next year. And then our intention would be to kind of assess where are we with that? Where are we with our eviction prevention efforts? I know there's some recommended additional funding for that also. And then what would be the right size needed to maintain a level of overflow sheltering that's needed, but not overexceed it. We do pay per hotel room used. So it's not the money, if we are able to prevent more, whether it's disasters because we're doing more education about fire safety, or whether it's keeping people in their homes and not experiencing homelessness, we'll have those funds. But this was our estimate in terms of where we see the numbers currently, what we would need to probably carry through next year, and then reassess if we can go back to where we were before, or if there is a slightly different number somewhere in between.
And you may be the person to answer this. So my next question might be something you were already going to explain. But with respect to, obviously, displacements that are caused by things like a fire in a building, where there are a myriad of insurance-related claims and issues to resolve, but of course the immediate need is I need a roof over my head because I can no longer access my building. Is there something that the county does in terms of participating in subrogation claims related to the insurance claim resolution on those incidents?
I am not sure whether we participate in insurance claim. We do bill to FEMA for stuff that's FEMA disaster, and obviously that goes as revenue. It sort of is treated separately as the expenditure. I can follow up on that question. I was just going to clarify one thing from before of, unlike newcomers, which has been in the base budget the last couple of years, right. This money has not been in the base budget until this year. It's always done as a supplemental appropriation because it was always offset with the FEMA money we were submitting to based on the COVID-19 stuff. So with that going away, we did move it into the base budget. We did do it as one time only for the reasons that Alana said, but it sort of has shifted to a little more permanent, you could say, of not being something that we're going to be asking a supplemental for. It's something that we built into the base budget this year.
Okay, thank you.
All right, let's keep going.
Thank you. So next item is the COVID sheltering in hotels. The executive is recommending $1 million to support that. So COVID-19 sheltering is intended for individuals who have tested positive and need to isolate and do not have a safe place to do so. Currently, the Healthcare for the Homeless staff provides daily medical check-ins for anyone staying in the isolation hotel. So council staff notes that FY24 may be a year to monitor, establish ongoing COVID-19s, particularly if it will become a seasonal virus. So staff's recommendation is to support the $1 million in one-time funding for FY24. And then we were saying the HHS committee can request an update of all COVID-19 related services and expenditures in January 2024. On April 27th, we'll talk about the COVID funding that's recommended in the budget of $4 million.
No questions or without objection? Okay.
Okay. And last item for recommendation is the $388,702 for security funding. This will provide 9 to 10 hours per week of security services at 3 of the shelters. Currently off-duty police officers are used through a private contract. The council staff recommendation is to support the additional $388K in security services.
Without objection.
Okay. And last item is a request from one of our nonprofit providers, a contracted shelter provider with SEF. In a letter to council members, Interfaith Works has requested an additional funding to support their shelter in support of housing contracts. The letter indicates a total request of $767,000 for FY24, of which $353,000 is identified to support the 4 emergency shelter programs and $414,000 to support the 4 supportive housing programs. The letter is attached. So we wanted to note that the total amount requested is $767K. However, staff notes that $211,000 of this fund is requested for a program that is funded through a competitive contract process. So council staff recommends that this $211 amount not be considered, as it would be outside of the contracting constraints in place. So with that said, we detailed in the chart of the $556,000 request. The majority of it is for personnel, but there is direct requests for client rent assistance and client assistance in general. So council staff notes that the detail provided in the communication in the personnel request did not include a breakdown of like the number of FTEs, the cost per position, and type of position. So that type of analysis we would do for county merit positions. So we were saying we would take that same approach when evaluating the personnel request. Part of Interface Works' request was also supplemental funding for a program funded through a competitive process for HUD funding. So this process includes a stakeholder review committee supported by DHHS staff. During this review process, some applications were reduced based on the decision of the independent committee reviewing the program applications. This particular reduction was largely reflective of a change in the program capacity, and I identified a need for more time for full implementation of the program that they proposed. So we are not suggesting to support that funding be added back until the program is fully implemented. We just wanted to note that DHS has a number of factors for considering funding levels for the shelter services. While there is a mix of types of contracts, there are multiple contracts in place for services among multiple providers for the continuum of shelter services. Council staff is concerned about identifying particular funding requests out of the context of those processes that were put in place as the overall FY24 budget funding level was established. So council staff does not have an official recommendation.
So I'm going to say a few things up front, and then I'm actually going to turn it over to staff to just get their thoughts and reflections. So clearly, we have a great deal of respect for Interfaith Works, their staff. There's an absolute acknowledgement. The needs have grown, particularly since COVID, and the inflationary expenses that they are experiencing are consistent with that of all other nonprofits and within county government as well. And it's difficult to be able to meet the needs of individual organizations as they come forward, because they're not alone, unfortunately, in coming forward with specific requests. So I want to get responses back from HHS, just because I agree in principle with the systemic approach in looking across the sector to see what more can be done on an individual basis to support folks, and whether there are other creative ways, facility management. I mean, there's crossover with county government and some of the services that we provide, and through potentially some economies of scale, could we meet at least some of the concerns that have been met and understandably put forward by Interfaith Works. But Councilmember Lukey, I think you may want to have some opening comments before we dive in.
Yes, just so I think this will help with the discussion that we're having. Obviously, thank you for flagging the contract issue. And that's really important because as soon as you start making exceptions on one contract, you're opening yourself up to making an exception on every contract. And, you know, I very much appreciate the new process that's been put in place for fiscal year 24 in order to manage the competitive grants and things of that nature. And one question I had is if you all could explain in discussing the different contract amounts, whether there's a portion of the contract amount for services to be rendered by a nonprofit entity built in for administrative costs. So, you know, a grant of X dollars is awarded and there's some certain percentage of that is typically applied to your overhead, right? Anywhere from 12% to like 23%, or if you're talking about the feds and universities, sometimes it gets really funky there and you spend less than half of the money on the services versus the overhead. But I think that that's really important to understanding what the nature of the relationship is between the county grant and the services provided, and then certainly some of the things that are being requested in the supplemental request for like the liability insurance piece, which I know they have to have a niche. You know, you're both a nonprofit, but you're also providing shelter services, and you also have certain security issues related to that, make their insurance coverage different than, you know, a different type of entity. We have other rental assistance, rental relief type programs. If we're carving out an exception in here versus what we're doing elsewhere, are we creating, again, more of a problem with understanding the full landscape of what we do have available and what we're spending it on? And things like facility maintenance would be something that I would think is part of the overhead that you take out from the contract that's awarded for the services. So those are the things I'm asking you to keep in mind as you explain this section of today's packet. Thank you.
Absolutely. To answer your question, yes, all of our contracts have an indirect cost rate that is allowed by the vendor to do the overhead administrative type of things. And so that varies by vendor. I could get it to you for these different contracts, but it is a indirect cost rate to cover those type of things. The one thing I would note is that even with the non-RFP contracts, it is sometimes a challenge for us to do increases outside of the inflationary adjustment and still fit within procurement law. Generally, we're not supposed to increase the amount we give for something if we're getting the same amount of services. The executive definitely supports Interfaith Works. When we got the request from them, we try to look at what items are new needs. And that's why we funded the shelter security, because we can say that's something additional, that's not paying more for the same type of services. But as Interfaith got the 8% inflationary adjustment this year, theoretically they will get whatever inflationary adjustment is identified for next year. To increase their funding above that sometimes runs into challenges with procurement law because we are then giving more funding for the same service, sort of different than how we treat all of the other vendors.
Right, and we need to avoid end runs around our procurement law because the procurement law is there for a reason. So, you know, again, it very much opens up a door that I'm saying this not because I don't love the work that Interfaith Works does, but because it structurally and within our legal framework creates problems. And I'm assuming that the contracts have built into it the language that allows you to do inflationary adjustment. And that is why that piece of it is not problematic, whereas these other things would be under the structure in which they operate.
Thank you. I appreciate that. Ms. Branda, your thoughts just generally?
I mean, I think Jason covered it pretty well. I mean, this is, and as you pointed out, this is not necessarily unique to IW. You got a letter from IW, but everyone's feeling strains in different ways, and we are working our best to try to mitigate those where possible. You know, a couple of these, you know, some programs are funded with a mix of federal and local dollars. Everyone's getting their federal renewals, but I'll tell you, you know, they did theirs. HUD did their regular NOFO before they released their updated fair market rent prices, right? And so, like, you know, everyone's trying to squeeze in and leverage as much out of, you know, that they can. I will say for, I believe, a couple, I'm just looking at the list from their letter, for a couple of these projects, it is part of, and we're crossing conversations, but part of Wednesday's conversations, there is the request or the executive's recommendations for additional funds for rent, which is one of the items they brought up, because we are recognizing, especially as HUD did not modify their contributions towards increased fair market rent, we are really seeing a pinch in that area of keeping people housed. Even those in our programs, right? How do we continue to pay the rent? Not even thinking about new people coming in for services. So there may be a little bit that we're able, if that section of the budget is approved, there will be some additional funds that we can move across all of our providers that are providing permanent supportive housing to help with some of that. But I mean, I think you guys all said it, where it's a tough position to be in. We also value the work of all of our partners. We could not be doing this without any of them, and appreciate the challenging position they are in terms of making the financial decisions they need to make to stay whole.
I appreciate that. Councilmember Sales.
Thank you, Mr. Chair. Just wanted to find out, how long has the county been contracting their homeless support services?
I think it predates everyone in this room, probably. There's always been most services have always been contracted out. The county does do some in-house, like we do our own rapid rehousing. Also, the overflow sheltering we manage versus having a partner manage the overflow sheltering. So there's some of the PSH programs we pay the rent for. So there's a small portion that we've always done in-house, but by far and large, all of it has been contracted out.
Yeah, I just, don't know why we are, parsing over how much we're giving this year, how much we're giving this, this is a service that the county prides itself on providing. This was one of our key initiatives to end and prevent homelessness. And so I just want to make sure that this resource is, this service, this program, their needs are fully funded, because this helps families get on the pathway to self-sufficiency. And so I want to make sure that, when we're thinking about this program, I don't know how we decide what goes into the base budget for certain programs, but I know that we have art programs in the base budget. We have other programs that don't have such a dire need and impact on our residents. And so I'm just wondering why every year this nonprofit and nonprofits that support this effort have to come back every year to ask for full funding. And so I'm just, wondering what the priorities are, why we would even think to put this on a reconciliation list instead of fully funding this important initiative every year fully, and ensuring that more residents are able to get permanent housing. So it's just disappointing.
So is the question, why aren't they in the base budget?
Yes.
And if I maybe just, I just wanted to clarify a little bit, which is that they absolutely are in the base budget. And as we were, there are so many pieces. I think it's certainly challenging, but they do have ongoing funding, and DHHS does establish factors for considering what the funding level is for the continuum of homelessness shelter services. And there are multiple providers that provide the shelter services. Interfaith Works is one. And so I think, you're right, it certainly is concerning that we hear from Interfaith Works. This is repeatedly. That said, I do think that systemically, one of the possible solutions on the horizon is this effort to have a competitive process for all of the shelter services, because I think that process will allow us to really see, okay, what is the overarching cost level that should be in place to support this going forward. I do think one of the complications with this individual request is, as we were saying, there are multiple providers and there are multiple contracts, and so I think that's where we would want to consider, certainly, again, the factors that were in place in establishing the FY24 budget level are probably, at least in council staff's view, the factors we would want to stay with for this level until we have a competitive process.
Yes, and if I can get a list of all the programs dedicated to providing homelessness services, ending and preventing homelessness services.
Certainly. So there is a table in your packet on page 3 that shows some of the specific shelter services contracts, and then we'll be really looking at that broader list that I think you're asking about when we have our joint meeting on Wednesday.
Perfect. Thank you.
Thank you. And Councilmember Sales, you're absolutely right. It is frustrating. The challenge, of course, is the need is outpacing these organizations' abilities to be able to meet it. And the good news is we do have a systems approach to ending and preventing homelessness that has actually been a model for the rest of the country, and one that we need to continue to expand upon. And although at the moment we may not be able to meet this individual request, there is some hope for our colleagues in Interfaith Works and in this really important space, which are, there was a recordation tax discussion this morning with the possibilities of some additional funds being provided for rental assistance. There is, in addition to what Ms. Branda mentioned, we have another year and a half of this administration, let's hope more, at the federal level. And we also have a state partner now who is open for business and is committed to doing much more than, frankly, the previous administration at the statewide level on safety net issues, and especially in ending in the preventing homelessness space. So this is a to be continued. This is not an end, and we'll see what more we can do. And as I mentioned up front, I will be proposing some across-the-board inflationary adjustments that will not meet this demand, but will help. And so more to come on that. And there will be more conversations on Wednesday as we continue this, but this is obviously an important one, and we very much respect the work of Interfaith Works, and we're going to keep this conversation going. So with that, I think we're good for now. Yes. And so we will now move on to the last item on our agenda, which is guaranteed income NDA. Yeah. Welcome back.
Just switch sides.
That's right. Dr. Bridgers, did you want to tee this one up?
Thank you, Council Chair Albernos. I'm really coming into the guarantee income pilot space. Ms. Treadvance and her team have done a great job in under this initiative, and also Ms. Dr. Richard Nimhard, who couldn't join us today because she just had a baby a couple of weeks ago. But the work that we've put into this effort has been it has been a great initiative, and looking at the data and looking at the outcomes, this is where we want to go. We want to look at data-driven outcomes that impact the community. We just had a very robust conversation on housing and access and affordability, but we want to go this route because we want all Montgomery County residents to have an opportunity to thrive and live and be successful in this space. So I will stop there. I will turn it over to my colleagues who are joining me this afternoon. But when I landed in this position as the acting director of the Department of Health and Human Services, this was one of our success stories. even looking at the vignette and the information that you yourself provided, Council Chair. I mean, the impact is just enormous, huge in the community, and those are the adjectives that I could think of as I think about this program. So thank you for the opportunity for me just to share the impact of this program and how we are focused on better outcomes in the community.
Thank you. Mr. Advance.
So I am joined by my colleague. I'll let her introduce herself in a minute, but I just wanted to say I've contributed nothing to this. I have not, because this was already underway before I joined, and it truly is the work of Dr. Oscar Mensah, our social services officer, Dr. Richard Nemhard, and Amanda Harris, the former director of Services to End and Prevent Homelessness. This has been their hard work, their hard sweat, having the difficult conversations. So, and Hannah has been a part of that team, so I want her to be able to introduce herself. So I am here only to represent, well, Hannah's the content expert if you have questions, but I just wanted to represent and call out the men and women who have been a part of this, who are not able to be here physically and in person. Hannah?
Good afternoon. My name is Hannah Shaw. I'm a program manager with the Children, Youth, and Family Services Chief's Office, and I am one of the program managers for the Guaranteed Income Pilot.
I'll just make a couple of opening comments here because I'm just so thrilled and appreciative of the progress we have made. I do want to acknowledge my Chief of Staff, Beth Schuman, and Pam, who is now working for Council President Glass, and the hard work they did early on, because this was a true and innovative approach that the state is looking to replicate in other areas. And we're hoping that, and are confident, that this is going to be successful and that this can be taken to scale so that even more families will be able to benefit, more individuals will be able to benefit, because it is directly related to the last conversation we had about ending and preventing homelessness, and really empowering our communities to be successful. So I will turn it over to Ms. Clements Johnson to walk us through the packet and look forward to the conversation.
Thank you. So the Guaranteed Income Pilot, NDA, is one of the several national pilots designed to change the narrative around poverty by providing a regular, unrestricted, guaranteed supplement to participants. In Montgomery County, the pilot provides $800 per month for 24 months to 300 individuals and/or households. The pilot consists of 100% participants who are transitioning from homelessness, including participants' households with children, and 200 participants with at least one child or dependent who had previously sought assistance from the county during the COVID-19 pandemic. Based on the timeline, the Guaranteed Income Pilot is slated to end by June 2025, and funds will be needed in FY25 to continue to assist with client payments and the evaluation. In terms of program enrollment, participants were enrolled through a phased onboarding process over a 6-month period, started in June 2022 through November of 2022. There was 3 bilingual coaches that worked with participants, providing barrier navigation and resources to other county programs, and also with support from the Collaboration Council with outreach events and that encourage participant engagement. And just some quick data points is that 77% of the participants are female, 73% of participants are households with children, and 53% of participants are Black African American. In terms of the budget, the FY24 recommended amount is $734,000. This reflects a slight reduction in personnel and increase in the client assistance payment amount. So at a rate of $800 a month and 300 households enrolled, the minimum client assistance budget needed is $2.8 million a year. With the additional financial support from the Meyer Foundation and the Greater Washington Community Foundation, the GIP is able to sustain assistant payments and provide support services as needed to households. Council staff recommendation is to approve the $734K as submitted by the county executive, and not indicated in this packet, we did identify it as a high priority item.
I just wanted to clarify, because the way it's written in the packet, it says that that the recommended amount is $734,000. It's actually, that's the difference between the FY23 budget and the proposed FY24 budget, for a net difference of $734,843. So I just want to clarify that. And I agree, put it on the high priority list. Thank you.
Yes. Councilmember Sales.
Thank you, Mr. Chair. So I, too, am a huge supporter of this program and look forward to seeing some of the accomplishments when the report's released. But I did have a question about other services. Can participants still access other government support programs like rental assistance, SNAP, utility assistance, et cetera?
Yes, so there are no restrictions on them receiving the benefits from the the pilot program. They can apply for any benefits that they would like to apply for, and their coaches assist them when it comes to benefits within the county, and then they will walk them through if it's a benefit that's not offered in the county.
Okay. I noticed in the packet that there are 4, I guess, overarching themes of how the program will be evaluated. Do you have an outline of, like, what exactly you're tracking to evaluate the effectiveness and success of the program?
Yes, so the evaluation is split into 2 parts. Morgan State is evaluating the impact, and I can make their schedule available. And then the Urban Institute is evaluating both how the program was implemented and then any unintended consequences, and they have a separate schedule.
Okay. Okay. And I support placing this in the high priority funding. That's it. Thank you, Mr. Chair.
All right. Not bad for a day's work. Thank you all very much. With that, we are adjourned today, and our next committee session is when?
The committee will meet jointly with the Planning, Housing, and Parks Committee on Wednesday, and then take up public health and all remaining items on Thursday.
Nice. All right. Thanks, everybody. We are adjourned.